All right, I think we might be live now. Sorry, guys, for the delay. We had some technical difficulties. It happens when live streaming sometimes, but I think we're good. Yes, we're on live streaming everywhere. Facebook, YouTube, and Instagram.
Yes, sir.
We got some questions coming in already. Fantastic. All right, let me just introduce everybody that's here today. So that's Chris giving you his backside right there. He's showing you how to use your glutes right. That's how you use the glutes right there. This is Coach Jay right here, Coach Raul.
Hey guys, how's it going?
I'm Dr. David, way over here.
Hey, how's it going?
And so we're gonna be answering questions here. We got our microphones today here, and we're gonna be doing some deadlifting today, some sit-ups, some calf raises. Don't hurt yourselves, fellas. Make sure you're using the glutes.
Yes, sir.
Always using the glutes. And lower abs whenever we're doing the sit-ups. And then when we're doing the calf raises, use those toes. So use all the right muscles. All right, so I'll get the first round of questions here. So the way this works, if this is your first time on the live call, I'm not going to do a teaching today. I'm just going to get into it. We're going to answer comments as they come along. I can see Facebook and YouTube comments on my screen. So if I look this way, it's because I'm looking at my computer where I can see the screen. My camera's right here. Can you all give me feedback and just tell me that you can hear me? Just give me like a thumbs up or something. I think we're there, right? Waiting for a comment to come through that says you can hear me because I am not sure if my tech is working because I had tech issues. Can you guys just give me some thumbs up or yes, I can hear you. Okay, Kay said, yes, I can hear you. Fantastic, Kay. All right, let's move on then. Thank you, Kay. You're a lifesaver. All right, so we got a super chat. Let me tell you guys about that too. So the way super chats work is if you're on YouTube, you can send your comment in with a little bit of money behind it. No pressure, by the way. I'm answering comments as I go through, but if you want to get it answered first, we'll do the super chat. So Tata gave us $5. No question on it, Tata. Maybe she didn't figure it out. I'll look for your comment, Tata, see if there's any question you have. But if you're just donating $5, thank you so much. All these guys, they work with me. We employ them to help answer questions. There's Tata. Sorry, first time doing super chat. My question not in the box. Type it in, Tata. I'll see if I can find it. If you're doing a super chat, by the way, my understanding is it limits you on characters in there, so just be careful, to try to get your question down as short as possible, so that it fits in the characters allowed. All right, let's see who's on. Sugar says, "What are the best exercises for someone with knee arthritis and fibromyalgia?" Oh man, that's a tough situation. Fibromyalgia. Well, with the fibromyalgia situation, that's where, for those of you guys that aren't aware, it's where you have pain kind of all over. I tell my patients all the time that fibromyalgia is not the best diagnosis as far as definitions go. There are definitely, I think, some cases out there that are true fibromyalgia, but I think it's overdiagnosed. In other words, there's a lot of doctors out there that kind of heard about it and are diagnosing people without it without taking the real measures, the tests to properly diagnose people with fibromyalgia. So as a result, there's doctors that have been overdiagnosing it and people get told they have it when it's not really the case. When you get diagnosed with fibromyalgia, you often get told that there's no cure and that you just have to manage with pain medications, and that's kind of the way that it is. So here's my thinking though, is I've only seen 2 real cases. I've seen a lot of patients that have fibromyalgia as far as their diagnosis, like that they were told they have that. But we probably have hundreds of them come through our office, but just 2 that I was like, I think this is legitimate fibromyalgia, not, you got told and it wasn't it. It's probably flared up nerves all over your body, and the nerves get flared up as a result of them getting compressed or pinched gradually in certain areas of the body, and it accumulates. Like you can pinch the nerves in your neck a little bit, then you pinch them in your back and your low back. You can pinch them in your hips and your shoulders, and as they all start to get pinched, what I think of it is like if your clothes were your nerves, for instance, they get kind of pinched and bunched up, and if this doesn't get released and it stays like that for years, and it gets bunched up somewhere else, and then down in your legs. If you imagine yourself in a onesie, that's kind of what's happening. Is you're getting your nerves all bunched up, and just imagine if I was in a onesie and my clothes were all bunched up, like I wouldn't be able to move. So then when you go to stretch out your arm and that the cloth needs to move, just like your nerves need to move on the inside of your body, it's not moving, so it hurts. And so it begins to hurt all over your body, your legs, your arms, your head, your back, everything aches. And then on top of that, you have arthritis, not fun. So here's my recommendation is move within what you can do. In other words, move to your tolerance within the ranges of motion that you can tolerate. You need to start to move. You should not be avoiding movement unless it hurts you more. And you have to play the game of, let me move as much as I can right now for the next 30 seconds, and then it starts to hurt, and then you back off, and then in 10 minutes, do it again. And you just have to work your way out of it. Be more strategic with your movements by putting in like glute activation exercises, because that's going to help you out with knee arthritis. If you have hip arthritis, same thing. So make sure that you're turning on your glutes. I have tons of videos about that in knee arthritis videos that I make on YouTube. In our free phase 1 of the knee arthritis program, there's stuff about that as well. You can go to our website and start accessing the knee arthritis recovery program. That'd be the best place to start. So I hope that helps you out, sugars. Let's see who's next here. We got AV Gonyama 1. I'm having a horizontal tear of the back horn of the inner meniscus for 2 years. No surgery, pain almost down to 0. Fantastic. How much and what workout is good? What shall I avoid? Yoga and twisting. Okay. Well, congratulations on your improvement in your meniscus. The fact that you have almost 0 pain is a good sign. I would make sure you're using your glutes. Make sure you're able to use your toe flexors like we're working out today. Abdominals are always key to work out as well. And start gradually loading your meniscus more within tolerance. Like when I say within tolerance, just to be clear, because I'll say that sometimes and haven't explained it, within what you can do without making it hurt more. You can challenge a joint. You can put pressure through it. You can go do deadlifts like Chris is doing right here and put some pressure through that knee using your glutes. But you've got to make sure that you listen to your knee. And once it starts to hurt, you're backing off. Lower the weights or reduce the reps, reduce the intensity, work within what you can. But while you're able to exercise, get those glutes working. Get those foot muscles working so that you are improving your strength as you go along. So I hope that helps you out. Oh, here's Tata's question. All right. She's the one that sent in the super chat. Seeing 2 different PTs for left lateral hip pain, got worse. Now right lateral hip hurts as well. Stopped PT, doing glute squeezes now, but sometimes numbness, both legs, down to feet. Help, please. Bless you. I'll bless you too, Tata. Glad you're doing the glute squeezes. Sorry that you're dealing with the hip pain, the lateral hip pain, on both sides now. I wonder what the PT did with you. If they probably weren't having you do glute squeezes if you're doing them now. So that's one step in the right direction. You need to be doing some glute squeezes. You need to gradually increase the amount of glute activation you're doing, tire out your glutes. Don't do any quad exercises. Don't do any hip flexor exercises. You likely have an imbalance. And the reason why you're getting pain on the outsides of your hips is because the muscles out there are overworking very likely. They're being over-tensioned and they're complaining. They're letting you know that, hey, we're working too much. So if you start using your glutes, you'll start to shut down those muscles and let them rest and recover so they stop hurting. You don't get swelling. It could be tendonitis, it could be bursitis, it could be a lot of things out there. It could be referred pain from hip arthritis, could even be a back issue referring out there. But glutes is central to this. Make sure you're doing abdominal work as well. Go check out our videos for hip arthritis. They will absolutely help you out, Tata. Great job doing the glute work. You guys want to jump in? All right.
Oh, warm up, I don't see that.
I've been warming up.
I don't see that sweat dripping anymore, man.
Hey, Zen Alive. Thank you for sharing your knowledge. Greatly appreciated. What is your thoughts on the vibration plate for seniors? Sorry, I'm not even on the camera here. I think that's fine as long as you don't have a nerve issue. If you don't have sciatic nerve pain, if you don't have any referred pain from a nerve problem, then you should be fine. It's not It's not a big deal. They can be useful for some people if they have an osteopathic problem like osteopenia, osteoporosis. So completely fine. What I would invite you to do is to, if you can, and if it's reasonable for you to start picking up some weights, that will help you even more. But thank you for that question, staying alive. Okay, we have, will swimming breaststrokes damage the meniscus tears further? It could. And I explain why. If you currently have a muscle imbalance where you're using your quads more than your glutes, then chances are that your knee has too much compression in it. So if your knees have too much compression to the degree that you have a meniscus tear now, then if you start swimming and you get all tight in these muscles, you could probably damage it further. However, if you work on fixing your balance first, if you work on fixing this meniscus tear, then swimming is a great way to exercise yourself because it's you're reducing the amount of weight that you're putting on your body, and you're still swimming up against some resistance. So, BH, I would just be cautious if you're still early in your process of healing your meniscus tear. Just stay away from that kind of stuff for now. Work on your glutes, get them a lot stronger so that you can relieve some of that compression in your meniscus tear, just so that you can give it the necessary environment so that your meniscus tear can heal. I hope that answers your question, BH. I want to see if we have a super chat here, but I don't think we do. I'm gonna go into the next one. Let's see. Tata V, thank you so much for your support. Okay, let me go on ahead and address. Tata B. Oh, you know what? I think that Dr. David already addressed this one, so I'm going to go upwards here. Okay. AVGONYMA1. So you're asking, I'm having a horizontal tear of the back horn of the inner meniscus for 2 years. No surgery, pain almost down to 0. How much and what workout is good? What shall I avoid? Is yoga or twisting okay? Great question. And by the way, good job on fixing your meniscus tear with no surgery. Chances are at this point you have fixed a lot of your imbalance, and that's why your meniscus was in a good environment to heal. What I would suggest is to keep on working on exercises like bridges, squats, maybe even some deadlifts. The key thing here is that you can utilize your glutes when you're doing these exercises. And they used to keep in the ratio like maybe 80 to 20%. Like if you're doing a deadlift, that it's at least 80% glutes and only 20% quads. Same for the squats. If you cannot squat all the way down, if you cannot squat super deep, that's completely okay. Squats are still a great exercise, even if you just quarter squat or you do a shallow squat. So keep on doing that stuff. Things that I would avoid if you have a meniscus tear is I would not, under any circumstances, get on the leg extension machine or the leg curl machine. Machines are not that great for leg development anyway, so I would just try and stay away from that kind of stuff. Work on exercises that allow you to use the hip. So what I'm talking about here is deadlift, squats, even some type of lunges. If you're gonna work on your thighs, you need to make sure that your glutes are involved somehow. Just don't put yourself in a machine that will isolate these muscles. Okay, and leave you with Jay here.
Hi guys. Where we at? I am enduring knee pain due to arthritis since about 3 years and don't want to go for knee replacement surgery, which doctor suggests for looking at my x-rays and my age. Hey, age ain't nothing but a number. Let's get that straight, okay? I truly feel we help hundreds of people, thousands of people even, at avoiding knee replacement surgery. And the way we do that is by correcting the muscular imbalance. So what we're working on is getting your feet nice and strong so you have better stability of the lower leg, getting your glutes nice and strong so that way it can help you to absorb shock and just increase power. The glutes are bigger muscle, right? And the lower abdominals, getting those nice and strong. Please check out our YouTube channel, free videos there. You can even try our knee arthritis recovery program, phase 1, for free. Go to our website, take the quiz, start trying out some exercises, and see how that makes you feel. But right away, I'll offer you this little tidbit. Glute squeezes. They can be done anywhere. It requires no setup other than simply your glutes. Work on squeezing your glutes and contracting that muscle for 10 seconds and then releasing. Repeat 10 times hourly, as often as you can. You have to become obsessive with that motion of getting your glutes involved and getting them stronger. Again, website, try out phase 1 for free. Link with us, get with us, work with one of us recovery coaches. I promise you, we'll take you to the promised land. Thank you for being here with us. Tata B, sorry, first time doing this super chat. My question is not in the box. That's okay. I hope it was answered. Lori Wilson, thank you for being here. Appreciate it. I'm recovering from sciatica and 80% improved after following your exercises since February. Any exercises to work on my leg weakness? Thanks. Hey, I'm very glad to hear that. And hey, 80% is huge. That is a great percentage of just healing. So great job there, remaining consistent and following along. Thank you for checking out that free information there. Legs. So I'm assuming now you kind of have good control over your lower abdominals and your glute muscles. So I would incorporate something like a mini squat. Hey, Rulies, you mind demonstrating a mini squat for me?
Yes, sir.
So I got Coach Raul over here. Yeah, show him the glutes, man. So here he's going to be demonstrating a mini squat. Talk to him a little bit, man.
Okay, so what I'm gonna focus on here is I'm gonna squeeze my buttocks, and I'm gonna let my thighs do what they want to do. What I mean by that is when you squeeze your thighs, you might feel like your legs want to spread out a little bit. Follow that. That's gonna be your stance width. The next thing that I'm gonna do is I'm gonna keep my chest down. Don't lift up your chest. Keep it down so that your abs are also working. And I'm gonna lead with my knees, and I'm gonna spread them out. So I'm gonna go knees out, spread them out. What does she look like from the side? It's almost gonna look like a dog is pooping on the street. That's more or less what it looks like. You're doing like this. But this keeps all the forces on your glutes, and your quads are not gonna do much of it. So just lead with your knees. Don't let yourself sit back like this. Make sure that you're keeping the hips forward, that you're squeezing your glutes, and that you're letting your knees spread out to the side. And you don't have to move that much. As long as you're moving a little bit and you can feel like your glutes are burning, that they're doing some of the work.
So even here,
then you're good.
Even that's a pretty deep squat.
Pretty deep, to be honest. Like you can even do it like this.
Right? Just very minimal movement. You just want to make sure that, again, you're keeping those hips, those glutes tucked under you and really keeping them engaged.
Yeah.
And hopefully that just helps you. That should help you with all over. You're engaging your feet, spreading your toes, gripping the ground. And then, of course, you're engaging your glutes, but you ought to see a little bit of activation in the legs. Just a little bit. Mostly we're focusing on the glutes. So just keep that in mind. Hope that helped, Lori. Got it, Doc?
Yeah. All right, I'm back. Here we got Bridget. Raul getting it. He's got 325 on there. I don't know. He's on rep. What is that? 99? 100? Just kidding. It's 325. Believe so. All right, we got Bridget. Oh, do we have any super chats? No, just Todd says it's still there. All right, Bridget A says I had a meniscus surgery in 2016. I have arthritis, and orthodox says I need a partial or full knee replacement. Also, my left knee is in pain and has some arthritis. I'm so sorry, Bridget. I'm bow-legged and both knees. Please help. All right, so let's talk through this here, Bridget. Sorry about your meniscus surgery and arthritis. Most of the time, the fact that you had a meniscus tear tells me that you've had this muscle imbalance for a long time, the one that's setting up the arthritis. The one that we talk about with working out the glutes, these exercises are probably going to be too advanced for you right now, but just can you turn on your glutes? That's where I would start out. If you think glutes tighten up, do the glutes actually tighten up, or is it all thigh muscles contracting, especially the hamstrings and the quads? Because if that's what happens in your case, then You got things to fix before you go have a joint replacement. I always tell people, like, don't jump into the joint replacement if you can't even fire your glutes right now, because it's not going to get any better after you do the joint replacement. They're going to do major surgery and your glutes are going to work even less than they do now. And other muscles are just going to compensate even more. That's what sets up people for having pain after the joint replacement. So go turn on your glutes first. Get them to work apart from your thigh muscles. Then after that, get them to work from left to right independently. After you accomplish those milestones, now you have a lot of exercising to do, a lot of strengthening to do. Now we can talk about doing stuff like what we're doing here in the gym. Let me be clear on that, guys. I know many of you guys have arthritis here who are watching us, or meniscus problems, and you see us doing deadlifts, and we've done squats, we've done other exercises here on these live streams. Don't do them. If you can't fire your glutes, don't do them. All these guys, I know they can fire their glutes. I can fire my glutes. So we're ready to do this stuff. Don't mistake us showing you this stuff, telling you this is what you need to do for your knee arthritis or your meniscus problem. Just showing you we work out. We're here with you. So go turn on those glutes, Bridget. Start there. See how far you can get before you go have a joint replacement. Oftentimes people just activating their glutes, using them better, their pain improves tremendously. And then they don't feel like they need to get a joint replacement. All right, who's next here? You coming in?
I'm going
All right.
down, right?
Just put it on.
Okay.
Margaret.
I'm going to scroll down or scroll?
No, you right?
Okay.
Yeah, Margaret. We don't have any.
Okay. Perfect. Hey, Margaret. Pardon the heavy breathing. I have spinal stenosis with lower back that goes down. Trying to see if I can see the rest of this question here. Okay. For some reason, I cannot see the rest of the question, Margaret, but let me make a quick assumption of your stenosis. So if you have spinal stenosis, you probably have some nerve issues or leg numbing when you walk, or maybe even when you're sitting down. With things like spinal stenosis, one of the major key players here is lower ab strength. So if you're missing out on some lower ab strength, what I would say is you might need to work on this on a daily basis, but do something you can tolerate. There's an exercise that is called a back press, in which all you do is you're just laying flat, looking up at the ceiling with your knees semi-bent. You put your hands right underneath your low back. You want to suck in your abs, engage those lower abdominal muscles that are massively important to fix or at least help a spinal stenosis problem, and then try to hold that tension in your lower abs for 10 seconds. Try and repeat that 10 times again. Like after you do the first one, repeat it over until you get to 10 repetitions. If you do this hourly, Margaret, what you're going to be able to do is you're going to be able to strengthen those transverse abdominal muscles that act like a corset for your spine. So if you do that, you can help yourself find relief and feel better with your spinal stenosis. I hope that helps. I believe I should be going down here. Okay, downwards. Okay, perfect. All right, Victoria's asking, do you think walking with a weighted vest would aggravate hip osteoarthritis and need to build bone density? It might not. It might make it a little worse. This is a tough one because you need to make sure that you're not losing bone density. That's very important for your health. But you also need to make sure that you fix your hip arthritis issue. A weighted vest is likely going to compromise your arthritic hip by putting more pressure on it that it already has. Hip arthritis is a pressure problem. What I would like to see you do is, I would like for you to make it a priority to strengthen your glutes and abs. And instead of relying on a weighted vest to increase your bone density, I would be picking up some weights and pressing them overhead, but sitting down. You need to be sitting down for this one because you don't want to have to bear weight. So sit down, grab some light dumbbells for now, press them overhead. If you can go to a gym and sit on a machine and just press this way, perfect. Bone density can act as a systemic issue. So, which means that even if you're loading the upper extremities, your whole body will benefit from a process called osteogenesis. It just means that because you're putting yourself under some strain, under some muscular strain, you might be able to help yourself build new bone. But you have to make sure that you're prioritizing the right things. So I wouldn't. I mean, if you were one of our people that work with us in the hip arthritis program, I just would tell you no. Like, don't use a weighted vest. Work on your bone density, but work on it in a different way, and fix your muscle imbalance. That's going to help you massively. Okay, I hope that answers your question, Victoria. We have Kimberly here. Hi, El Paso Manual Physical Therapy team. Hi, Kimberly.
Can you jump in?
Yes, sir.
All right, Kimberly's on. Hey, Kimberly. Glad to see you on here. We check if we have any super chats here. None today. Just Tata. Hi, Tata. Shout out to Tata. All right. Who's next here? We got Kay Miller says hello. Sarthak Sharma says, how to recover from a bucket handle tear? Is it necessary to have surgery? That's a tough one. A bucket handle tear is kind of like one of the less desirable meniscus tears in the knee. It's a cartilage tear. But my advice is always fix the muscle imbalances, get the glutes stronger, get your feet working right. Quit getting your quads to work so much, because when those quads are just overactive, they just are pulling the kneecap and the shin bone up and adding a lot of bad pressure, bad compression to the knee joint, worsening the pressure on the meniscus, which can hurt the bucket handle tear. But there's a chance that your body's trying to heal all the time. If you can offload that knee joint by getting the glutes stronger, you're going to give the bucket handle tear a chance to heal, even if it doesn't heal. Because a lot of people will say that, and I can't guarantee that it's going to heal. I can just say that you can take pressure off the joint and you have the best chance of healing. And I've helped tons of people get to that, even with bucket handle tears and other really bad tears. But just run this scenario, Sarthak. If you have a bucket handle tear, doesn't hurt though, because you fix the muscle imbalance. You can go up and down stairs. You can go walking. You can do exercises like that. Why have surgery? If you're very functional, if you're very capable to do things, your knee's not hurting, your knee's not swelling, don't have the surgery. Wait until it does become a problem, because it's not necessary. It's not stopping you, so it's not necessary. And if you fix the muscle imbalances, then mechanically speaking, your joint's going to be more sound, more working appropriately. So that's my advice to you, Sarthak. We got a super chat. Andy Surfer here says, he sent a super sticker. Hey, Andy from New Zealand. Thank you, Andy. Appreciate it. Everybody say thank you to Andy.
Thank you, Andy. Appreciate you.
Thanks, Andy. No question with that one, just a donation. Thank you so much. Appreciate it. Let's go to the next one here. We got Erica Walker. Hello, love your content. Well, thank you, Erica. I hope it's helping. That's what we always hope the most. Kimberly says, hi again. EPMPT team, thank you. Got it on my shirt today. All of us do. Brenda Truce does soft wave therapy work. That's one of we call them like modalities. It might be beneficial for pain relief. There's all kinds of different wave therapies, like infrared, but like the light therapies, light waves as well, but like sound therapy, ultrasound. There's shock wave, soft wave. There's different kinds out there. The research is very mixed. None of it is like conclusive, showing that it's going to work. But I always go back to, does it make your glutes stronger? Does it make you use your toe muscle stronger? Are your abs getting stronger? No. So maybe it gives you temporary pain relief, but it's not fixing the root problem. Don't be surprised if that temporary pain relief goes away by the end of the day, or maybe a week at best. It's like taking pain medications, but I'm all for using that stuff if you're avoiding the medications because of the side effects associated with the medications. Good job, Chris. Push those knees out against the arms. There you go. When you do that, you activate those glutes good. There you go. Good job. Oh, I commented here, apparently. My team commenting. All right, who else do we have on here? Edwina Frankfurt. Thanks for all your great help with my knee. You're welcome, Edwina. Glad it's benefiting you. Kenneth Ropan says, hi, doc. Can I undergo ACL and meniscus surgery even if I have a flexion contracture? Whew. Flexion contractures are tough. So a contracture is when a muscle is like constantly holding and doesn't want to give up. Usually there's some nerve problem. Maybe you were born with a condition or you had some nerve injury that set this up. There's a couple other conditions that will set it up, but it's going to be tough. That's a unique situation. That's not one that we run into every day. I can't say from this point with the little information you gave me, your best bet is to go talk to your doctor, your physical therapist, get a good idea of what's possible given your situation with the contracture. The contracture is just going to throw a wrench in the plans, but it doesn't mean that you can't get better necessarily. You have to see what's possible depending on what your medical professionals say around you. All right. Oh, we got a super chat. Super chat. Who's here? Kathleen. So everybody say thanks, Kathleen.
Thank you, Kathleen.
Hey, Kathleen, thank you so much for your support.
She says she has a question. We're going to find it here. All right. Kathleen. Sorry, it got buried in all our other questions here. Where you at, Kathleen? Whew, it's way down. Oh, I found it. All right. Kathleen says, had a lumbar laminectomy 10 days ago. Oh, man, so sorry. L3, L4, and L4, L5. I assume I should continue to do the reverse pelvic tilt as I engage my glutes. Should I avoid anything that arches my back? Thanks, Kathy. Yes, you're on the right track, Kathy. You should be avoiding anything that bothers your back. If arching your back hurts, definitely avoid that. As far as exercises go, because it was just 10 days ago, usually like the first month, you don't want to do a whole lot of exercise. You're going to do some, right? You're going to have to walk around, get around for everyday things. You got to take care of your body, all the basics, right? So that movement to take care of your basic biological needs, eating, that kind of thing, is exercise for your back. And that's kind of all you should be sticking to, unless your doctor told you to do something else and has you maybe working with a therapist or something, then do that stuff. But as far as other exercises like pelvic tilts, which I talk about people sucking in their abs, that does the pelvic tilt motion. I think it's a good thing to do. I would definitely have you doing it if you were here in person, as long as you don't have any bad things going on. Because of that, I would just test it first. I'd say, okay, do it a little bit, do that pelvic tilt, suck in your abs, tighten your glutes a little bit. How does your back feel? Feels good? Okay, that was 10%. Now go 20%. Now go 40%. Now try 70%, and find the percentage at which you can hold and maybe walk around and do things with, because ultimately that's what you want to be doing day to day and getting better at it. As you improving your mobility and pain starts to diminish more and more, then I would look to do more exercises that involve that all the time, pretty much. Like everybody should always be bracing their abs. Not always, obviously, when you're asleep, but if you're going to be active, if you're going to go on a walk, if you're going to exercise, if you're going to do a chore that's a little intense, a little more intense than like sitting around, you should be sucking in your abs a little bit, because it gives you stability. It protects your spine. It's very often the case that people that don't do that because they're sitting a lot or they're deconditioned or they're not using their abs for whatever reason, they are going to go do those activities with turned off abs, and as a result, their back muscles take over and it starts to wear away at their discs and their back joints. So it sets up surgeries like this. So I hope that helps. I would not be doing like bridges right now. I'd wait to talk to the doctor. I'm a strong proponent of, if you just had surgery, listen to your healthcare professionals. I help people who are trying to avoid surgery. So if you just had surgery, I'm not your specialist. There's people you should be working with probably in person in your town, wherever you're at, that should be helping you out, because they're surgery specialists and post-surgery specialists. Just telling you what I would do, though, if you were here in the clinic. I have helped people like that. It's not what I do day in and day out. That was a long time ago for me. All right. Let's go on to the next one. Let me find you here. Whew. We're almost done here. We have a few more minutes. We're probably just going to get to like A couple more questions here. We have Margaret Berkman. She says, I have spinal stenosis with lower back that goes down, and follow up one right away. Or did you already talk to Margaret Berkman? I think you did, right? Because about spinal stenosis,
Yeah.
lower back. Okay. I saw that one. Okay. We talked about the bucket handle tear. All right, where are we at? I lost track here. I talked to Edwina. Oh, this is the one we were on last. Kenneth. Okay, so now we're on Land King. You want to get going here? All right, we're on K Miller. You hit it out?
Oh yeah.
Okay.
Just talking to the camera here to document the butt kicking that Dr. David just gave us.
Yeah.
Deadlift day is always a little rough for everyone. So that was K Miller. Now we got 123 Rockchild. How can I determine if I have a hip labral tear? I'm going to get that one, or?
Yeah.
All right.
Determine, yeah.
Well, number one thing is getting an MRI. The MRI is going to let you know because that sees the cartilage. But usually people have pain at the end range of hip motion. Like if they bring their knee all the way up, it'll hurt like right here in the front of the hip. Also coming in across body, it'll start to hurt in the groin area. Those are the biggest signs you have like labral hip pain, labral hip tear pain, but it doesn't always mean you have a labral tear. The number one thing you need to go do is get an MRI. That's how they'll determine it. But even if you have groin pain or front of the hip pain, it's a sign that you could have a labral hip tear in the works, which usually it's glute strengthening that fixes that. So I'd go look at glute strength. Oh, we got some super chats.
Super chat.
Who's here? Chantel says nothing. Thanks, Chantel. I thought there was a message. Sorry, Chantel. Thank you, Chantel. And then we got Rebecca Robbins, question below. Okay, we're going to look for Rebecca's question, and then we got to go. Rebecca Robbins. You guys got us hunting here. This is a little tough because there's so many. Where's Rebecca? Where you at, Rebecca?
Rebecca, question below. Okay.
Question above, not below. Okay. Here we go. I found it. Rebecca Robbins posted this on Facebook too. MRI showed a piece of cartilage broke off in the knee along with some arthritis. Doctor suggests gel injections. Do you recommend that and your knee arthritis program? Will it heal? Oh, this is a good one, Rebecca. If the cartilage broke off, I wouldn't be worried about what they call like a floating body sometimes. I wouldn't be worried about it unless you're getting joint locking. Like you go to bend and straighten out your knee and then it stays in a partially bent position. You can't fully straighten it out. That's joint locking. If you're consistently getting that like several times a day, then you might consider having a surgery to clean it out or whatever the doctor recommends at that point. But the gel injections could be beneficial. They're very experimental at this point still. We don't have certainty that they work. They don't always work. From my accounts with patients, it's like hit and miss, 50-50. So it's up to you on that. Absolutely, I would recommend my program because even if you do have some joint locking, maybe it's not super frequent, you might be able to reduce it, maybe even eliminate it if you get the muscle imbalance fixed to take pressures off the knee joint. Usually your body will reabsorb things that shouldn't be there. It'll figure out a way to get rid of it, usually, not always. And so I would go with that first because even if you do have to have a surgery, say like a joint replacement surgery, and you don't fix the muscle imbalance, then you might still have problems afterwards. Maybe now it's not the loose piece of cartilage in your knee, it's some other issue that was maybe originally causing the pain and that wasn't addressed before the surgery. That's what I'm talking about you addressing right now. Everybody watching this is for Rebecca and for everybody else. You all need to get your muscle imbalances fixed before having surgery. It's going to benefit you on so many levels. You're going to have a better outcome if you end up having the surgery anyway, and maybe you don't even need to have the surgery because you're feeling so good. Try that first. All right, we got time for one more. Oh, we got one more super chat here. Chantel. She says, why can't you start Romanian deadlifts with your arms between your legs, or can you? Oh, that's a good one. What do you think? Romanian deadlifts. I like the Romanian deadlifts. I like deadlifts with your knees between your arms because when you push your knees out against your arms, it just better activates your glutes. But yeah, talk to the guy that's picking up heavier than everybody else here.
I think, okay, so I think when you do a deadlift, you have a good chance to train your glute really well because you're stretching your glute as much as it can be stretched. I mean, you can still stretch it more, but the Romanian deadlift will challenge it a lot. Like Doc said, if your legs are inside of your knees, what's going to happen is you're not going to have anything to push up against with your knee. So you're going to lack a little bit of activation. Chances are maybe you can squeeze your glutes. Maybe you have that much control. But if you don't have enough control over your glutes, I would recommend something that you can actually control well with your body. Like in this case, a deadlift with arms outside of the knees, super easy to learn because you just got to think about 2 cues. One is push arms push knees up against the arms. That's going to activate your glutes right here. So when you do this, also your hip is going to get closer to the bar. This part is important. The farther away your hip is from the barbell or from the dumbbell, whatever you're doing, the less you're going to be able to engage the glutes compared to the hamstrings. So you're pushing up against, hip gets closer to the bar or to the dumbbells. Now what you can do is you can keep on rotating out and push your hips through. This is going to give you better glute engagement. You can grow some massive glutes with just conventional regular deadlifts. Romanian deadlift, you don't have anything to push up against. When you're doing it like this, your knees are semi-straight. Hamstring is super stretched out. Your glutes are some as well, of course, but you're going to split it 50-50. You're going to go be 50-50 hamstrings and glutes. So, I mean, it's fine, but for maximal glute development, for maximal strength, have your arms outside your knees. I hope that answers your question, Chantel.
There you go, Chantel.
That was great.
Good explanation. Better than I could have done for sure. Thanks, Ode. All right, guys, we're going to wrap it up. All right, we got one more super chat came in. Oh, we got a new member. Somebody joined the membership. It wasn't a super chat. Kundan is a member on our channel. Thank you for joining, Kundan. Look forward to seeing your comments and questions. All right, guys. Thank you all so much. Say bye, everybody.
We love you guys.
Love you guys.
Chris is
Where's
back
Chris?
there.
Hey, this is the man. If you've ever called our office, you're gonna hear his sweet voice. No one does it better than him. It looks like there's 500 of us because of him, but it's just him. I just want you guys to know that, okay? Chris is the man.
Thank you.
See you guys.
Bye,
See you
guys.
Bye.